Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it. So, my dear friends, in the last class, we were discussing about the fetal intervention and inculcation of the holistic properties. In that aspect, we have seen the Avyakta Prakriti or endowment, then comes the Mahan, then the first manifestation, then comes the Ahankaras, then three types of Ahankaras and its relationship with the Eid, and how this Eid has to be fulfilled, what you mean by Daurhuda, and what is the relationship of Daurhuda and Eid or genetic drives. So, all this part we have seen. And Daurhuda stage has to be managed very well because the wishes of the mother is not the wish of the mother, it is the wish of the growing fetus. That is nothing but the impulsive drives which is coming from the fetus, which is also called as ahankara. So we know that this stage is called as Daurhuda stage, and insulting the desires of the Daurhuda is called as Daurhuda avamana. And this part also we have seen. Just coming to the next part, what happens after birth? What happens to this Eid or these desires of the baby after birth? Or in other words to say the ahankara after birth. After the birth, there will be interaction of the Eid with the environmental factors of the race and the family or the religion, stimulus, satisfaction of the needs and the parental love. Now we know that the desires of the mother during the fetal stage has to be fulfilled. Now once the baby come out after 9 months, that Eid or desires will be there also, isn't it? The same, because it is the same fetus which is giving that Eid, impulsive Eid. Now even after birth also this Eid will be there. So now even after birth also these desires has to be fulfilled. Now what actually happens is during the pregnancy period, most of the time we will fulfill the need of the mother or wishes of the mother. But we fail to understand that this is not the wish of the mother, actually this is the wish of the fetus. But after birth, the same fetus which become a baby now is also showing some of the wishes, and that has to be fulfilled. Previously also we have fulfilled, and now also we have to fulfill. If you don't fulfill, just like Daurhuda Avamanajanya Rogas, here also there will be problem. Okay, so after birth there will be interaction. Now same Eid of the baby, after birth what happens? Previously there is interaction of the, in the fetal stage, there is interaction of this particular Eid with the mother and mother's environmental factor. That means uterine factors. Okay, but after birth the same Eid is now exposed to environmental factors. What is the immediate environmental factors for the baby, newborn baby? That is the family members, home environment, etc. Okay, mother, especially mother, the caring of the mother, love of the mother, concern of the mother. So that is the immediate external environment to the baby, and here the baby is exposed. Now the Eid of the baby is get now interaction with the familial environment or with the mother or mother's care, love, etc. Meantime, the family environment, it is also exposed to the family environment, how the family members talk, how the soothing environment the family members provide. Similarly, religion, some of the religious customs, etc. It is also exposed to that as the baby grows. Stimulus, how the stimulus in the family, whether everybody is talking to the baby, whether everybody is interacting with the baby. So depending upon this, the Eid which is already present inside the baby will be get fulfilled. If you provide a good stimulating environment, it is good for the Eid to develop. If you provide a subsiding or a negative environment, that is very bad for the Eid, okay, or ahankara. So now these instinct drives, Eid or the ahankaras of the baby is now modified as for the familial environment. Okay, it is now modified as for the environmental factors in and around, and now it will be likely to take to important pathways. So after birth, when this Eid is subjected to the familial environment or external environment, okay, now it can take into two important pathways. What are these pathways? One is pathway is a negative pathway, another one is positive pathway. What is the meaning of it? Now, Krodha and Harsha. These are the two important things. That means if you provide a positive environment to the baby, good love, concern, opportunity, everything to the baby, it runs in the track of a Harsha pathway. But if you provide a negative environment, then it runs in a path of Krodha pathway. So that we will discuss. Now what do you mean by Krodha first? Krodha means aggression. We know that anger, aggression, etc. Negative feeling, totally a negative feeling, isn't it? Now, if you look into the factors, little or normal aggression is normal to the baby. Everybody will have some amount of krodha or aggression, and that is considered as physiological. And this little amount of the krodha is also considered as a stimulus for better psychological construction. It should not be more, it should be little. Okay, it should be little. A mild amount of krodha is very good for the psychological development or construction, but more amount of the krodha or completely krodha only, so then it is good. What do you mean by this? Now, if you look into Kashyapa, when he explains the Prashasta Bala Lakshana, so there he says, baby cries, anger, then satisfaction, adhana, and then growth, development, stability. So these are some of the normal features of the child, Prashasta Bala Lakshanas. Okay, that means some amount of the krodha should be there. Totally krodha less is also not good, because that little amount of the krodha is a stimulating factor. Okay, but it should not be more. But if the krodha is more, a negative environment is more, okay, so then what happens? So why this can occur? This can occur because of very stringent rules. This can occur because of very stringent rules, strict punishment, strict punishments or scary talks, abusing talks, etc. So very stringent rules, strict punishments, scary talks, and abusing words, etc. may lead to excess aggression in the growing baby. Okay, it should be talked very smoothly, politely, with all love and also with compassion and all. Okay, instead you are imposing very strict rules, okay, which has got no meaning, etc., where a baby fail to understand what actually it is, or strict punishment if there, or scary talks. A environment is totally scary or producing some fear complex in the baby. So these are all the things which make the baby to run in the krodha pathway. Okay, so what actually happens is this leads to krodha, which consumes more energy of the baby, and a little energy is left for the libido, harsha. That means total the energy of the baby, psychological and physical, that particular temperament and otherwise energy of the baby, it totally consumed by this particular unwanted aggression, and a little amount of the energy is left for the libido. And this leads to poor and abnormal development of learning, behavior, and personality. This is a problem. Okay, when this happens, this leads to abnormal development of learning, behavior, and personality. So krodha and the harsha are inversely proportional. If the krodha increases, harsha decreases. If harsha increases, krodha decreases. Now, what is the outcome of this aggression, more aggression? When there is more aggression is there, what is the outcome? The inadequate harsha with more aggression like kama, krodha, etc. are characteristic features of rajoguna, as told by Sushruta. Okay, so when child fails to get what he desires, that is kama, the aggression increases. Aggression increases. The krodha leads to indiscrimination in perception of the good and the bad and grief of the troubles, told by the Gita. We know that. Stability of the mind lost due to more rajodosha. Ultimately, when aggression is increased, krodha is increased, the rajoguna also increases. Rajoguna is more fluctuating. Okay, so mental stability is not possible. Number one. Then usually when krodha increases, kama will be there. That kama is a desire. Now, if you're not able to pacify the krodha of the baby, if you're not able to fulfill the desires of the baby, kama of the baby, then naturally the krodha will go into further increase, and that consumes more energy, and less energy is left for the harsha, the another pathway, the positive pathway. So, by the study of libido and aggression in relation to himself and to the others. So, same is mentioned as harsha and krodha in Ayurveda. Okay, so both satisfaction and frustration are normally seen in the growing child, but you should be under limit. If anything is more, then it is problematic. So there should be equal mixing of these two in normal growing of the child. It's not like that only you fulfill the baby with the harsha only. Some amount of the krodha is required. Therefore, Kashyapa included krodha under the prashasta bala lakshana also. Okay, that some amount of the krodha is very important, which act as a a stimulating factor. But it should not be excess. It should not be excess. Now, this is what I told. This is exactly explained by Ayurveda. So, a growing child means what Kashyapa says: angry, crying, sleeping, wake upness, and shows the signs of satisfaction, aggression, evacuation of the bowel and urine, and normally and takes the feed in the normal course and digest it properly. So these are all considered as prashasta bala lakshanas. In that, aggression is also there. Okay, so thus it is obvious that any psychological disturbance has got its effects on the disturbance of the feeding and the excretory functions. So tension of the child should be kept under normal limits, and the child should be unhurted. Okay, now this is what happens. Now next we come to the next part, that is ego. So far we are talking about Eid and its interaction. Now come to the ego. So what do you mean by ego? Ego and superego, these are the two words. What do you mean by ego? The personality which develops from the interaction of the Eid with the environmental factor is called as ego. After the birth, when the baby is exposed to the external environment, the Eid of the baby is get exposed to the external environment, family environment, the personality that baby develops. It may be a krodha type, it may be a harsha type. Okay, that baby that is called as ego. Okay, so ego may be influenced greatly by the mother. Okay, so that personality that baby develops after birth for next few years, that is greatly influenced by the mother, as she is in close contact with the baby, and baby depends on her for most of the basic requirements. So even Dhatri or the wet nurse may also influence the same. Therefore, Ayurveda says when you are selecting the wet nurse or Dhatri, be extra careful. So many physical and psychological characteristic parikshas are done for the Dhatri also, because she has got a lot of influence. Therefore, Kashyapa says Asha, Dharma, Kripa, Sneha, Rakshanartancha Mataraha. So she has got such a great influence over the growing baby, because that part, maybe mother or maybe Dhatri, she plays a vital role in the development of a good quality ego. Okay, so this is called as ego. So what do you mean by super ego? So that we will go into discuss in the next class. Thank you very much.